Having a baby is a joyous, wonderful event, but then there's risks. Women used to die. The mortality rate for women was really high.
It is one of the biggest risks a mom faces when she comes into the hospital.
Grandparents are there, both her parents, my grandparents. Everybody's ready, excited. She gives birth. Everything goes swell. I cut the umbilical cord. They give Finley to Ashley.
Within a minute or so, I asked somebody to take the baby from me. I said, I don't feel right. I remember somebody saying my arm seemed to change colors.
Don't know what's going on. I know it's not good. When they took Ashley out of the room, it looked like the floor was just covered in blood.
By the time I got up the stairs, which was just minutes, they were already in the operating room. It didn't take long to realize that we were in trouble.
Everything was slow motion.
It was a very scary moment because from that moment, there were already a bunch of people running back and forth, but it seemed like it doubled. You could see a whole bunch of people running back and forth with just bags of blood and liquid.
And everybody's talking to each other. I need this. Somebody else over here. I need that. Can somebody run and get this?
When I walked into the OR and saw 10 different caregivers running around trying to save Ashley's life, it became a very heightened emotional experience.
It's a hysterectomy or she's gonna die.
We're trying to get a big line in her neck to more efficiently give blood, and her saying, please don't let me die.
We looked around the room and we knew that her life was in our hands.
Pressure, lots of pressure.
Lots of pressure.
She's in 14 right here. We're lining up just to see.
The next morning it was early, and I remember I walked around the corner and there was her husband standing there. And that's when the tears rolled.
It was a very emotional time. A lot of tears were shed.
Woke up with tubes down my throat and had no recollection really of what went on at that point.
Then it was like a miracle she started coming to so fast.
She was just very grateful to be alive.
When Finley was brought up to the ICU for the first time, she was overjoyed, excited, happy.
There was probably 10 nurses in the hallway, all so excited, waiting.
I'll never forget it.
It was like something lifted off of me. I felt so much better.
It was beautiful.
It was a special moment, and finally getting to spend time with her. A lot of the nurses were saying that if they didn't have the prior sim lab and everything, that they don't know if they would have acted as quick and efficiently.
They had just a couple weeks prior implemented a thing called a mass transfusion protocol, which saved her life.
Every nurse, every physician, every year practices these high-risk situations so that when Ashley comes in, we've seen it before, we've done it before, and we've mastered a teamwork approach of addressing these situations. No mom expects to come to the hospital and have nothing but a normal, healthy delivery. But when that rare event happens and you have a medical emergency, we will be ready.
It was a very scary moment, and they were there with us. Not only just to take care of my wife, but also us, family members. And without these certain protocols that were in place, I don't think my wife would be here.
That's what it's all about. When somebody can come back and they're healthy, it makes you smile that you made a difference and that there's this beautiful family and this beautiful woman and her husband, and they made it.
It had to have been the hand of God. It showed God's love and his strength for us and how he was there and how he took care of everything. I'd hate to imagine what would have happened if she went somewhere else.
Big and small makes a huge difference in some people's lives, especially mine.
I'm grateful and glad that she's here.